We're now joined by Mike Marin, who is the president of Holy Name. Mike, you are not at Holy Name up in Bergen County. You're actually in Haiti as we speak right now.
That is correct.
Put some context.
So we have Hôpital Sacré-Cœur, which is in the town of Milot. It's in northern Haiti. It's a 200-bed hospital that Holy Name took over in 2011 and has been running ever since.
Yeah, we've had many conversations with Mike over the years about Holy Name's work as a medical organization, as a hospital organization that he just described. But I want to lay this out, Mike. Talk about the challenges of Haiti, and Mike will tell you in a second the way to be helpful if you want to be helpful. The hospital, on November the 1st, the hospital was forced to close its doors after an attack when an armed group tried to abduct a patient. The hospital reopened in late December 2021. There was a 7.2 magnitude earthquake that hit Haiti, killed more than 1,400 people, almost 7,000 people were injured. The president of Haiti was assassinated in July 2021. Mike, how much has all these things impacted the work that you're trying to do in Haiti?
The impact here has been, it's just been one challenge after the other, Steve, right? COVID is rampant here. Cholera was rampant on top of all those other atrocities. It makes every day living here very, very difficult, very challenging. We're talking about the most impoverished nation in the Western Hemisphere. People live here the way they lived 500 years ago. There's been some advances in many areas, which is one of the ironies. Almost everybody has a cell phone, but they're still living in bamboo shacks with dirt floors and all the other sort of no fresh, clean water, no utilities. All the things we take for granted at home just don't exist here.
Mike, explain to people again why Holy Name is even involved in Haiti.
So we got involved really through one of our great physicians and a board member at Holy Name, Dr. Dave Butler, who's an obstetrician, gynecologist, been on our staff for 40 years. Dave got involved down here about 30 years ago and would come down on regular trips, and we would supply him with medical supplies and drugs to bring down. And it was after the earthquake that Dave asked for me to join him on one of those trips. And when we saw the devastation and we saw just how bad things were, we believed we could make a difference. And so we made the commitment, and we've honored that commitment for the last 12 years.
As we put up the website, if people want to be helpful, let everyone know what the situation is as it relates to COVID in Haiti right now, particularly at the hospital.
So it's very much like at home. We have spikes, and then we have a recession. At the moment, we're on the tail end of a spike. So we have about 10 patients at the hospital today who are COVID positive in isolation that we're treating. Untold numbers in the community because there's no testing here. There's no way to really monitor and surveillance the size of the virus. We can only tell by the way people present at the hospital, in the ER, and ultimately get admitted.
As we put up the website, what can people do to be helpful?
So the greatest help is funds. Haiti is while it's an unstable environment politically, unstable financially from many, many points, what Holy Name has done is added a level of security and a level of insurance. So I can assure you that any donations that are given to us for Haiti, 100 cents on the dollar will come to Haiti and will absolutely make a difference. It will not be stolen. It will not be diverted. It will be deployed right here to provide direct patient care. And that's really what these people need at the moment.
And let me disclose this. Holy Name is one of the healthcare organizations, one of the hospital organizations that is an underwriter of what we do, particularly in the area of healthcare. Follow up on this, Mike. What is the medical team facing? The physicians, the nurses, the respiratory therapists, what are they facing? Because it's one thing to talk about what they're facing in the United States. It's another thing to talk about Haiti. What are they facing?
Well, think about it here. There's a very limited supply of interventions. So we don't have monoclonal antibodies. We don't have the vaccine. We don't have a ready supply of oxygen. All the things that you need to combat COVID just don't exist here. And so what we do is the best we can with the limited resources we have. We hydrate people. We try to get them breathing by mobilizing and moving them because there's only one ventilator in the entire hospital, and that's for a population of 2.5 million people.
Go back to the vaccine issue. People talk a lot about vaccine accessibility in the United States, responsiveness, resistance, et cetera. Are you saying that in Haiti, the vaccine's not available? Not
available. Yeah, they are one of the 3 countries in the world that do not have a formal vaccine program. Part of that's because of the political unrest. Part of it's because the U.S. just hasn't really helped. The U.S. shipped, for a population of 12 million people, we shipped 500,000 doses of vaccine once, and that was it.
Why is that, Mike?
Don't know. I've asked right up to the highest ranks in the Biden administration. I asked because Holy Name runs one of the largest vaccine centers in New Jersey to be able to divert some of our vaccine and bring it down here. We were denied that request. It's illogical to me. It makes no sense. And I get the rules around transporting drugs, and I get the rules, but we've always made exceptions in times of crisis. This should be one of those, but that failed to rise to that level.
Mike, I'm curious about this before I let you go. You've been heading down to Haiti, going down to Haiti for a decade now?
Yes.
So the resilience, the grit on the part of the people of Haiti is extraordinary. But you also mentioned, in the time we have left, you mentioned political unrest. What impact does political unrest have on healthcare, the healthcare of the people of Haiti?
So again, when supplies are held hostage because of gang rule, give you an example, one of the most valuable commodities for us is diesel fuel, because we use diesel fuel to run our generators. There is no public utility. So we have to generate our own electricity. Imagine trying to run a hospital without electricity. Well, when the gangs hijack the diesel trucks because it's liquid gold and the trucks can't refill our tanks and we have to limit our generators, it impacts the whole operation in a very, very significant way.
Mike Marin in Haiti. Mike, thank you for joining us.
Thanks for having me, Steve. I appreciate it.
Stay with us. We'll be right back.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by the Russell Berry Foundation, the New Jersey Economic Development Authority, NJM Insurance Group, Horizon Blue Cross Blue Shield of New Jersey, Choose New Jersey, the Port Authority of New York and New Jersey, the Robert Wood Johnson Foundation, the New Jersey Education Association, and by Suez North America. Promotional support provided by Meadowlands Chamber and by NJ Biz.
NJM Insurance Company has been serving New Jersey policyholders for more than 100 years. But just who are NJM's policyholders? They're the men and women who teach our children, the public sector employees who maintain our infrastructure, the workers who craft our manufactured goods, and New Jersey's next generation of leaders, the people who make our state a great place to call home. NJM, we've got New Jersey covered.